welcome, everyone. We often do medical news and medical reports, and I was really fascinated to hear about something, a medical treatment that is coming into its own, gene sequencing, and they're using it to personalize treatments. So whether it's to determine which deaf children would benefit from cochlear implants or hearing aids, certain kinds of breast cancer. There are all kinds of studies going on now that are trying to determine how to best use this. Dr. Elizabeth Chow is director of what they call, and I think I'm getting it right, is it translational medicine?
That's correct.
Ambry Genetics. First, let's explain, because when we were talking about this piece, a lot of people here said, well, what does that mean? What is gene sequencing? So let's start from the beginning.
We can start from the beginning. So gene sequencing has been going on for a long time and has been available for a variety of genetic diseases, some of which are more common, and you may have heard of, like cystic fibrosis, some of which are very, very rare. But it has always been a test which is relatively expensive and technologically has been challenging. More recently, because of some changes in technology, gene sequencing has become much easier and less expensive for us to do. And so we've moved into the realm of sequencing lots and lots of genes in some gene panel testing, as well as more recently kind of a form of genomic sequencing that we call exome sequencing, which is essentially sequencing all the genes in each individual.
And as I read in this piece, that it's personal medicine, but sometimes not only is the cost prohibitive, you need to be able to store the information, and that sometimes people find out things they don't want to know or didn't know. But how do they use it? For example, there are certain kinds of breast cancer which carry the genetic mutation. Mm-hmm. Can gene sequencing be effective in that area, and what do they do?
Yeah, so we do gene sequencing to look for forms of hereditary breast cancer. So there's a lot of different genes that can be involved in hereditary breast cancer. Sometimes when we see a patient, it might be more obvious to us which gene we want to look at, and so we might order single gene testing. Sometimes it's not as obvious, and so there's a number of genes that we would want to look at. And if we do find a mutation in one of the genes that puts you, at high risk for breast cancer, there are actually really well-documented guidelines, well-accepted guidelines for things you can do as far as increasing screening, so getting mammograms more frequently, starting at a younger age, and in some cases, depending on the risk, even prophylactic surgery can sometimes be an option. So getting a mastectomy, for example, before disease, before you develop breast cancer, in order to prevent it. So there are options that we can provide our patients with based on the results of a gene sequencing test.
So let me ask you this, which, Elizabeth, if you do this, and let's say it's a genetic form of breast cancer, mm-hmm. Can gene sequencing turn it off? Mm-hmm. That's the question when people think of genes. Yeah. You've got a mutation, maybe you can fix it.
Right. So for the example of breast cancer, there hasn't been any data on that to date. But we're diagnosing a wide variety of conditions using exome sequencing. And for some of those, there are options. So, for example, we recently had a case at Ambry Genetics. We did what we call whole exome sequencing, which is basically looking at about 20,000 genes. And we diagnosed a gene that was involved in a specific form of blindness. That family then was able to use that information to get enrolled in a clinical trial for a form of gene therapy. But they needed to know which gene was mutated before they could be enrolled in that clinical trial. So we were able to really help that family move towards hopefully a useful treatment.
And what about things like Alzheimer's or heart disease?
Those are more complicated, right? So like breast cancer, these are conditions that not only have have a genetic input, but also have an environmental input, right? So there are some genes that might tell you you're at increased risk, but a lot goes into trying to determine whether someone will develop what we call these more complicated conditions. It's not just genetic. So there's some information there, but not as much as we hope to date.
Well, the story that I clipped, I think it was, I don't even remember what paper, it may have been the Post. It was a weekend paper, and you talked about these twins they pieced it, who were so sick, they relied on inhalers and adrenaline just to be able to breathe. You remember that story? Mm-hmm. And
yes.
These twins, literally because of this gene sequencing technology, their lives were changed. Now, why?
Well, their lives are changed because now they know what the cause is. And the one thing that can't be overlooked is how important this is, not just to the patients, but to their families. So, for example, the mother in that case mentioned, she spent years wondering why this had happened to her family, if it was going to happen again, what she could have done to prevent it. And so for her, finding out that it really was this genetic diagnosis was very, very important. There's another family member in that case, too, a sister who was thinking about having children of her own because she had grown at this time, and she was worried about the implications for her having children. Because we made this genetic diagnosis, we can now determine if she carries the gene and then talk to her and her partner about what their risk would be for passing it on. So it really is, it's important to the patients, but it's also very important to the families to get this sort of information so they can understand what they've been going through and what they can expect in the future.
Right, and actually, as so many families do, stop playing the blame game. It's my fault. Being able to go forward. So what is the next step? I'm talking to Dr. Elizabeth Zhao, who's Director of Translational Medicine at Ambry Genetics. What is next for all of you who are involved in research and in this area?
So I think that the next steps right now are just, this test is very new, so we're using it to diagnose patients, every day, every week we're getting more samples in. And I think, as it moves forward, this is going to become more common. As our abilities get better, we're going to be able to diagnose more complicated diseases and to make this test hopefully more useful to individuals out there who do have a genetic condition. It's amazing how this has grown over the last year. We started doing this sort of testing back in September of 2011, and already we've had many families that we've been able to help. So we're looking forward to more of that and being able to tackle more complicated cases.
Thank you so much. Really fascinating information. All the best to you.
Thank you.